Good afternoon. It's a gloomy day here in the Midwest. It's September 25th. And I want you to look at that headline. Pandemic errors scrutinized. That was in the paper today. We are going to see a lot of spinning of messages over the next year as we sort out what's happened over the last 3.5 years. I am not going to stand quietly and idly by watching some of this message madness and manipulation go on. I'm just going to call it out when I see it. So I'm going to say this. If you're wrong, acknowledge it. If you are wrong and you decide that you're going to try to spin a message so somehow you can save face and come across as being right or less wrong, shame on you. Let's look at the article. Pandemic errors scrutinized. It starts out like this. Minnesota is using a $17 million federal grant to learn from the pitfalls of COVID-19. Goes on to say the pitfalls of COVID-19 forecasting in the last few years, and to improve its predictions for the next outbreak. So in the first paragraph, we're given the impression, okay, our predictions weren't so good, and so we've got to do better. And we got a chunk of money from the federal government for $17 million, so we're going to look into it. One of the people that's involved with this project is someone who's involved in health informatics. This would be like statistics regarding healthcare and combining epidemiology and things like that in public health. This person says, quote, think about the public trust cost of being wrong. I agree. Think about the cost of being wrong from a public health perspective over and over again, and how that cost organizations trust. Okay, so what does the rest of the article say? Well, it says this. Minnesota was among the first states to publicize COVID modeling estimates in spring of 2020. Well, I remember this very well. I was vice chair of the Health and Human Services Committee in the Minnesota Senate. I spoke on the Senate floor about this, and I was ridiculed by some of my colleagues and thousands of other people. But I remember this very well. Minnesota was among the first states to publicize COVID modeling estimates in spring of 2020. Governor Tim Walz based a statewide stay-at-home order on predictions that 74,000 Minnesotans could die if nothing was done. Here's what the article says. This is not me writing this. This is the article, and it was written by Jeremy Olson, Star Tribune. It says this. Sketchy information about the new coronavirus strain led to overestimates of the death risks. The state is now approaching 15,000 deaths after more than 3 years. In other words, the prediction was 74,000, and it went even further. It said that in the summer of 2020, there might be 1,000 people dying per day in Minnesota. I said at that time, I wasn't buying it. And then the modeling was reduced to 29,000, and I said I wasn't buying that. Well, we're not to 15,000 yet after 3.5 years. But it goes on to say this. The modeling was wrong because the denominator of total COVID cases was vastly undercounted and mostly based on hospitalizations. So in other words, you'd get a case of COVID. And the modelers evidently didn't realize that for every person that was identified with COVID, there might be 5, 10, 20, 50, or 100 others that hadn't been identified. So they were using the wrong denominator. I said this. I said this over and over again. But here's where the rubber hits the road for me. It says, despite the numerical misses, in other words, the crazily erroneous predictions, despite the numerical misses, the early Minnesota COVID models succeeded at their primary purpose, giving state leaders estimates of how policies such as social distancing or nursing home closures would affect viral transmission. Well, that's absolutely not true. That's messaging. That's spinning a message. Missing the mark by some 400 or 500% didn't succeed in giving our state leaders useful estimates as to how effective policies such as social distancing or nursing home closures would be. If you remember, in 2020, Minnesota was virtually nation leading in the percentage of COVID deaths that were in the nursing homes. Our nursing home policies were horrific. People died alone. Families still grieve the way their loved ones died. This was not helpful. This hurt. This gave false premise to way wrong-headed policies. And the other notion that this somehow told us about efficacy of social distancing. Do you not remember that while in Minnesota and so many states, it was 6 feet social distancing, though in a lot of European countries, it was 1 meter or 39 inches. But then we had the reports that if we were outside and someone was jogging by us, they might be creating some sort of slipstream, some sort of vortex of wind, and we maybe should keep 32 feet away. Having erroneous modeling did not help us at all. It led us down a path that we would prefer not to have been led behind. Folks, the public trust has been absolutely fractured. And if we're going to rebuild it, we've got to be honest. I mean, I've been clear that in the early months of COVID-19, frankly, for almost the entire first year, I was inclined to think that the origin of the COVID-19 virus was a natural reassortment in nature. Now I would say that I was wrong. I think that 3 months after the CDC director, Robert Redfield, stepped down from his position and came out and said that he could not comfortably buy into the notion that the origin of the virus was a spontaneous reassortment of RNA in various animal species. But instead, he thought that it was more and more likely that it was indeed created in a Wuhan virology lab. That really got me reconsidering what I had been thinking. And I kept reading, and everything I read made me think more and more that I was wrong. And I do think I was wrong, though. I think the jury is still out at some level, but I think the FBI and the Department of Energy and many others have said, yes, they think that this was a lab leak and the virus was created in a lab. I think we've seen a recent report where 6 out of 7 CIA investigators went over there, looked into it, felt like, yes, this probably came from a lab, but somehow they decided to, if you will, generate a conclusion that said that it was not able to be determined. And then there's a question as to whether or not some money changed hands. But let me just flip this around a little bit. Let me give you a different example from a way different example from what I just showed you in the paper today regarding this erroneous modeling. Let's look at a guy named Dr. Paul Offit. Now, I don't know Dr. Offit, but he is a highly regarded vaccinologist. I believe that he was part of the team that created the current rotavirus vaccine. I'm going to guess that he's been involved with patents and he's probably made some money off that rotavirus vaccine. In the first part of the COVID-19 pandemic, Dr. Offit was absolutely on board with the vaccines, and I would say he went so far as to be a champion of them. I think that he's come out saying that he's received 3 or 4 vaccines for COVID. But he came out recently and he said he's not getting the booster that's being released in the current time, the next week or two. Some places are having trouble getting a hold of supply. But Dr. Offit has said he's not getting it. And he's also saying he did not get the bivalent booster last fall. He's saying that he got 3 or 4 shots. He also got COVID. He believes he has hybrid immunity, and he thinks that that's the ideal immunity. But he basically made a comment that I thought was really very sage. He said, you can't ask someone to take a vaccine if the reason for taking the vaccine is to prevent serious illness, but you can't demonstrate that the person you want to take the vaccine has any serious risk of serious disease from it. To shorten that up, he's basically saying, if someone doesn't have risk of serious illness, and that's all the vaccine provides, then you can't expect them to take it. That, to me, was pretty darn straightforward. I don't know Dr. Offit, but I would commend him for being so candid. And also embedded within his comments was, I think, a relatively clear acknowledgement that natural immunity has real value. And I think we saw during the COVID pandemic, natural immunity absolutely blown to smithereens, kicked under the bus, and treated like it was not a real thing, even though we've known about natural immunity for more than 2,000 years of recorded human history. So we've got two examples here today. We've got on the one side, incredibly erroneous modeling that gave justification to create a premise for lousy, non-science-based policies that hurt people in a real way. And then on the other side, we've got someone like Dr. Paul Offit saying, you know what, I've looked at the data. There's a whole lot of doubts about what's going on. Dr. Offit even mentions the risk of vaccine-induced myocarditis. And he said, I'm not taking the vaccine this fall, and I didn't take it last fall. And you know what? I don't think Dr. Offit's alone. I think a lot of people are saying just what he's saying. I think that's why you're looking at statistics nationally, and you're in terms of seeing who has gotten every one of the vaccines or boosters that they were eligible for or advised to take. It's a very small minority. If we're going to rebuild the trust over the next couple of years, the article in the Star Tribune and the healthcare statistical person who decided to sort of make this sound better than it was, whether it was the statistical person or whether it was the author of the article, I'll probably never know. But I know this. Taking models that were as erroneous as the models in Minnesota and using them to sort of run a victory lap in regards to your nursing home policies and your social distancing policies is wrong-headed and ill-advised. And as far as I'm concerned, whoever's responsible for that kind of message spinning is revealing a character flaw.